this video, I'm going to show you a simple routine that you can do the next time you have lower back pain. All we're going to need for this particular workout is our body, a mat, and a blanket or two so that we can actually lift ourselves off the mat. As we get started, particularly if you're currently dealing with some lower back pain, I want you to begin by lowering yourself down onto the mat. We're going to begin with some pelvic tilts. So if you notice when you're on the ground, gravity is already kind of pushing you into the floor, but I want you to use your abdominal muscles and do that a little more exaggerated. When you do that, you're going to find yourself exhaling, you're going to find your abdominal muscles contracting and your lumbar spine straightening out or flattening out. Then on your inhale, I want you to do just the opposite and lift your lower back away from the ground. So let's do that again. As we exhale, we flatten that lower back, relaxing into the glutes. And then as you inhale, we're arching up into that lower back, coming into that nice extended spine. So as you're breathing normally, the goal over time is to go back and forth. Now, many times people have a difficult time, particularly on the lifting your lower back off the ground part, because maybe your spine has suffered some arthritic changes, or maybe just by nature, you don't have a lot of motion there. It doesn't matter if you can actually see it, I want you to feel it. So when your lower back is flat, you're going to feel your abs. And when your lower back is lifted, you're going to feel your lower back. At no time am I really contracting my glutes, but I want you to take your time with this and use your breathing. Remember that always, especially with back pain, less is more, so try not to push quite so hard. So now as we take one of our knees into the chest, automatically that lower back comes down, and I want you to very lightly use your hand as resistance. Put some engagement across the front of that hip on your inhale, and then exhale back down. Changing sides, bringing that in, let's draw the other leg back in towards the center, again with the emphasis of engaging those hip flexor muscles, and then exhale back down. This time as you draw it in again, I want you to place your hands on the front, but see if you can now work towards extending your knee. Now that may or may not happen. Exhale and come back down, and then do that one more time. So we're drawing it as far as possible. Hands meet the leg, gently draw the leg back into the hands, and if you like, you can work on extending your knee. Then lower that all the way down. Now let's just begin with a straight leg over here. Both hips on the floor. Inhale. How far can you raise your leg? If you're at 90 degrees or more, use your hand. If you're below there, let's say you're here, you're just going to use gravity. So wherever you are, we're just holding it, working on squeezing around the hip and the knee, just for a few seconds. No cramping or shaking. And then exhale. We're just going to stay on that same side. Rest for a moment. Then as you inhale, let's do the same thing. Try to keep your knee extended or straight, and then move your leg back. This should feel so good. Many times we have back pain because our hip flexors are weak and our lower back is tightening up to prevent us from using it. So that's why these isometrics can be so helpful. I do these all the time with my clients because we sit in a sedentary culture, and these muscles are definitely going to get weak over time. So let's just change sides again. We may notice as we go from left to right that our range of motion dramatically changes. So you may notice maybe your hamstrings are really kicking in on this side. Why would they do that? To prevent you from hurting the muscles on the front of your hip. So that way we have to lower our position. In other words, don't come up as high. Maybe add a bend into the knee, or try not to push into your hand quite so far. Remember, baby steps is the key. This routine, I hope, will help you to uncover where your weaknesses are. And guess where they're going to show up? When you're tight, other muscles are actually weak. The tight muscles are having to protect you from using those weak muscles. Good. Last time, inhale, breathing. Let's bring that up. Move the leg into the hand to hold it. And release it. So now as we bring one knee into the chest, I want you to exhale, roll yourself up off the ground. Now, whenever I sit on the ground, I like to tell my clients, especially when they're dealing actively with a back issue, grab a blanket or two so that you can actually come up off the floor and feel more comfortable. It really opens up that hip angle. Make sure that you're sitting up straight. If you have to lean back a little bit, not a problem. If you have to come forward slightly, that would be great. But wherever you are, you should be feeling muscles here. You may need to bend your knees. A lot of people are here, but this is a telltale sign of why a lot of people have lower back pain. So now the first order of business, can you sit up straight? Engage muscles right across the tops of those thighs and the knees. Most importantly, right here, work on sitting up straight. Over time, work to get your shoulders to stack over your hips. This is going to be a very important thing for a lot of us to work on. Inhale, breath, and release it. Now, if this is comfortable, go ahead and bend one of your knees. Now, when you have that knee and you're in flexion, I want you to take one of your hand against it, then the other, and work on sitting up tall. Now, it's really important that you're not trying to pull yourself up. You're using your muscles. Once you have this memorized, can you let go and move your hands behind your head? Hold it and breathe, and then exhale, release. Let's try it again. I want you to press into the floor, sit up tall, bend the other knee and hold it, tighten your abdominal muscles, then take one or both hands on the leg. Again, try not to pull yourself up. Allow your lower back to do its job. And if it's appropriate for you, place your hands right here on your head so that you can sit up very tall. And then exhale, release it. So now with both of the knees in flexion, I want you to lean back slightly. Take one hand to the floor and then one hand to the back of the head. Sitting up straight, I want you to turn your body and rotate to the right, then bring that back to the middle. Let's do that again. This is just a nice little calisthenic here, actually just a mobility exercise. And I want you to notice each time you move, are you moving a little more? When you're done moving now, place your hand on the inside of that leg, creating that isometric, sitting up tall, and release it. Changing sides. Inhale, breathing, both hands on the floor, sitting tall. Exhale, other hand comes behind the head. It's very important now as we rotate to the side, we are not rounding our back. We're trying to stay as upright as possible. So every time I begin that rotation, I'm telling myself, sit up straight, and then I go into that rotation. One more, and we're back in the middle. So now, as we come back to the center, both hands are behind the head holding. Turn towards that leg, and now place the hand on the inside of that knee. I know you can feel this for 5, 6, 7, and release it. So now as we come off of that, let's move our blankets out in front of the body. So from here, we want to place the blanket right here on that fold, right at the crease of the hips. This will bring our upper body off the ground. Separate your feet about hip-width apart and bring your arms to your sides. Tuck your chin and roll down. This will automatically feel amazing just being here. But I want you to work on pressing your hips down into the mat, tucking your chin, and then from here, try moving yourself off the floor. And even if you only get to the height of the floor, you're already getting resistance and you're off the ground. Hold that and then exhale, lower. Try that again, easy. I would definitely recommend tucking your chin and looking at the ground while you're doing this. And back down. Now I want to add a rotation. As I come up, I'm feeling both of my hips on the ground, but I'm adding that turn. And then exhale down. Then as I change sides, I want you to always be aware and notice where your range of motion deficits truly are. So let's do that a couple more times. Squeeze and rotate. And back down. And again, squeeze and rotate. And back down. Now as we come back to the center, let's just hold it here for 5, 6, 7, and release it on 8. As we finish today, let's go ahead and bring our blanket around into a rectangle and get right on top of it with our hands and knees. From here, I want you to focus on pulling your hands toward your knees and isometrically pulling your knees toward your hands. As you do this, round your back, coming into the cat stretch, which is not really a stretch. I'm trying to engage and tighten my abdominal muscles. Now as we push our hands and knees away from each other, let's lower that waistline and feel that lower back, which enables me to work my spinal extensors. One more time, pulling together into that cat, tighten the abdominal muscles. Inhale, pushing apart lightly and feeling the lower back. Then I want you to come into a position of neutral, which is right in between the two. Take one leg straight back now and see if you can lift it off the ground. And what this is going to do is bring in your glutes. Now, if this bothers you to kneel, you can certainly do this in standing or lying down flat on your stomach. And then exhale, bring it down. Other side, extend your knee back. And now using that glute, come to center. Such an important exercise to do because these muscles attach right along your sacrum into that lower back. And if I have a weakness on one side, man, it'll definitely make that lower back hurt. So now if you like, I can add the opposite arm. Now this is an option. This is oftentimes talked about as being one of the best exercises to do because it does work the muscles contralaterally. I'm going from the right hip to the left shoulder, trying to really work on the muscles that line the back of the body. So let's do that one more time. And now see if we can move them together without moving them piecemeal, right? And this will take some time. A lot of times, the first time somebody does this, they're super wobbly. And then exhale, release it. As we finish, let's go for one more cat stretch, tighten up those abdominal muscles. Then one more extension into that cow, and then we finally release it. So when we finally come into that sitting position, what we should notice now is that we feel much more upright and much less pain. Avoid the temptation to lay on the couch when your back hurts. Motion is lotion. I know that sounds very trite, but it is true. Not only should we be moving, but we should also be engaging our muscles in a very purposeful way. If you'd like more information about this, I have a link below in my program, Fitness Integrated Science TV, where I have lots of therapeutic routines and recipes to help you with lower back pain and other things. Otherwise, make sure you're subscribed to the channel, and if you like this video, give me a thumbs up and share it with your friends. Thank you so much for watching, and I will see you on the next video.